Hello, leaders of the world. Welcome to Spread Love in Organizations, a podcast for purpose-driven healthcare leaders striving to make life better around the world by leading their teams with genuine care, servant leadership, and love. I'm Naji, your host today, joined by Patrick Youssef, Director for Africa in the International Committee of the Red Cross. Patrick joined the ICRC in 2005 and completed different missions in Sudan, Chad, Iraq, Guantanamo Bay. And between 2010 and 2013, he was the deputy head of operations for the Near and Middle East. He was the head of the delegation in Iraq for more than 2 years before taking the role of deputy regional director for Africa, managing operations of the Red Cross in the continent. In addition to this field experience, Patrick worked on specific topics related to the respect of international humanitarian law, such as the treatment and judicial guarantees of persons deprived of freedom, the recruitment of children in armed forces, and transitional justice. In January 2016, he was recognized by the World Economic Forum as a young global leader. He sits in the International Council of Advisors of Global Dignity. Talking about having an impact in health, on humanity, and on the world, I am so humbled to have Patrick join me today. Patrick, can't thank you enough for your time and so much looking forward for our chat today.
It's very exciting to hear your intro and hopefully to get the best out of this podcast. Thank you.
Patrick, I shared in the beginning your impressive work in the humanitarian field and in one of the most respected institutions, which is the International Red Cross. Can you tell us what got you there? What is your personal story from being born in Lebanon to this noble purpose you are striving towards every single day?
I think life is just, an assembly of opportunities. And what brought us to our knees back in the Lebanese civil war and the different episodes of violence and war in Lebanon probably twisted us to become more humble, get more into a service-driven purpose, and helped us to join, modest or less modest institutions like the Red Cross in Lebanon. From there, I thought that the best way for me to put in combination my passion to serve, to help, and my professional aspiration as a lawyer was to simply go and decide to professionalize my passion. Simply looking at the ICRC was, looking into the ICRC was my remedy in a way, the solution for what I wanted to do in my life. And that's what got me into the International Committee of the Red Cross, which combines, again, the passion to a profession, a drive to try and help people, try and change behaviors during wars and armed conflicts with something that becomes part of your style of life. You decide to become an expatriate and go to the field. You decide to be exposed to all sorts of risks when you're with the Red Cross in Iraq or in Somalia or in Darfur back in 2005. And this becomes in a way part of who you are. And that's indeed how I was brought into the ICRC and stayed for over 15 years now.
Yeah, and you talk about it in a simple way, right? We shared a little bit in Lebanon, but you've been in fields even with more war, with more hard times during your humanitarian experience. You're talking about your purpose. I'm interested to hear, like, in one sentence, how would you define this? And really what made you go and every single day literally risking your life practically? And as a leader, how did you lead during those times teams who are actually thriving towards a purpose, but that can, at the end, unfortunately, sometimes be harmed physically, and we lost martyrs, unfortunately, with the Red Cross.
Yeah. So first, let me go back to the Lebanese Red Cross times and the experience I had when I think when serving in the Lebanese Red Cross and being at the forefront of people, not being able to get the social services they deserve. The Lebanese Red Cross during the Civil War and the different, again, episodes, levels of violence in the country played an important and prominent role to bringing assistance and medical care to those who really need it and couldn't afford a private service. So in that realm, in that field, I really put in practice the values that my parents taught me, the questions that you would only hear in theory, but put in practice when you're surrounded by a group of volunteers, a group of people with huge hearts and wanting simply to be part of a community and help. And here I think comes the learning. The learning comes from watching others lead, and you start learning and trying to imitate and become like them. That's where I think the roots of helping and trying to serve come from my local organization, the Lebanese Red Cross. The ICRC, indeed, when you know that you won't be able to join and sit in nice places, although Iraq is a nice place, but it is not a place devoid of risks, and taking risks kind of becomes an inherent part of your work. And again, trying to imitate, but also learn on the job was the only way I defined purpose, defined the purpose to continue working, but also again to join the passion and the job. No one at the ICRC or in an organization with a similar mandate and a set of values would simply acknowledge that this is only a job or a profession. We won't be able to last for 5 or 10 years without having the force and the drive to want to make a difference. And although we're not lame and superficial, understand that it takes years to see impact of your work, and indeed, it's the impact of your work is only a part, one level of trying and changing behaviors of weapon bearers, of rebel groups, and I think that's the purpose that you just asked about. It's the definition of where you see a combination of your own work, the small and modest piece of the puzzle that you only add, but you kind of understand quite quickly that without this, the puzzle will never be completed. So you kind of reinforce your work, you put in heart when needed, but you also put your professional and expertise in the work. And that's what differentiates us from a charity. We are bound by the Geneva Conventions to deliver, to remind weapon bearers, and to be at the forefront, to be the frontline organization, not the keyboard activist who tries and changes the situation from afar. We are the ones on the ground working with Red Cross and Red Crescent volunteers. And you get only inspired by the leadership of so many of our colleagues that puts you in a position where you either assimilate or you get out. And once you decide you're in, you go all the way in, and that's where you start feeling the impact and the sustainability of your actions.
Yeah, and you shared that it's more than a job, it's passion and job, right? And this is what you're doing daily with this purpose. I know you worked before joining the ICRC, you worked in the private sector. Any leadership lessons as you're leading these days, especially you're saying like passion and job, but again, you talked about those risks. Your volunteers or people working in the ICRC are taking every single day for themselves, their family, their lives. Anything from a leadership standpoint that you felt is kind of similar through your experience in the Lebanese Red Cross and the private sector, and now leading a huge organization across Africa with ICRC?
Well, you can do your job. I think you can be miserable in a job, and you kind of accept it because you get the gains, you get a capital, you get some learning, but you can still remain miserable. In the humanitarian sector, you can also do that, but with the risk taking, being miserable can only add to your suffering and doesn't get you any dividends. You don't see much the return on investment. The return is never financial in the humanitarian sector, because what you get is a modest contribution to your work, but what you get in essence is a sort of a set of development indicators that you look into when driving change, when trying to make something happen within your organization. And I think that's the difference that I felt, although I didn't spend many years in the private sector. I just had few jobs here and there. The only career path that brought me to ascertain my leadership role was in the ICRC. That's the only example I quote every time I'm asked about this. And there, I think, the job itself doesn't procure much, does procure development, personal growth and development, but it's also what you make of the job and how you try to spin every learning into a lesson of life. That's what I saw, for example, in Iraq back in the days. I had a prominent leader who taught me quite a lot, and I considered him to be one of my mentors, if not my mentor, in defining what impact is and how courage in the humanitarian sector should take much of a larger space, in the sense that if we don't highlight the reasons why people suffer, then why do we exist as an organization? That was one of the lessons that taught me, our work is not only about feeding people or giving water and medical attention to people, but it's also about protecting. That's why the Red Cross was created. It's about protecting people, those who are vulnerable, those who are voiceless, and those who are, caught up in wars and violence. And I always give that example because it kind of changed my way of looking at the Red Cross and looking at my work and the footprint that I want to keep after getting into an Iraq or a Darfur and, trying and making a difference. At the end of the day, again, it's not about the amount, but it's about the capital that you keep. It's not about the numbers, but it's mostly about the quality of your work and what you keep and you retain, I think, as an individual, as a leader, as a parent, as a husband. And that's the impressive, I think, role of becoming mature in your job, is how you delineate, how you use your profession to become a better person, or become a better, not only professional, but a better person. So I'm not sure I succeeded in that, but it's on the way.
Yeah, you did a lot. It's, and the beauty along the way of what you're doing is, being a better person and improving the world, right? And you talked about protecting those populations, those in need. This is something that drives you. And I'm interested to double click a little bit more. You talked about Iraq and having a leader there who inspired you, and you've been in many different zones where you were the leader, and people were looking into you. Any experience that you can share with us from the field, as a person, leading those teams with ups and downs, with moments, I'm sure, where people were sometimes afraid, right? Many times we don't talk about our emotions, but it's a real thing, right? For people to be able to continue on delivering on the purpose and why they do the job. Any experiences you can share with us here, and what are the one or two learnings that you took out as a person, and also on how you can impact broader?
Yeah, I mean, there are many experiences, but the one that I think about, and that was back in the days in Iraq when I headed the ICRC delegation there for 2 years. There, indeed, there was a time when the ICRC was very much at so I started there in 2013, so a few months before the war broke out between the government and the Islamic State in Mosul and many other provinces. And that was the time where indeed our operations kind of grew up steadily and grew in size because of the suffering and the humanitarian needs that this war has taken. One of the experiences I had was, again, to focus on inclusive leadership in the environment I was managing, as I thought that purpose is not only about how much you deliver, but how you deliver and how you lead. And I was in a privileged position to be the head of delegation, so I could indeed not impose, but propose certain ways of looking at leadership and becoming more of an inclusive leader. And I practiced that. One of the experiences was indeed in Iraq with many of the heads of structures in the field. So as you know, we have a delegation normally in the capital, consider it as an embassy, but then you have substructures in where we do have operations. And the first thing we thought about, myself and my team, was to ask how people were, how the individuals who are not devoid of feelings, emotions, family connections, how they felt about impact and how they felt about doing that job. And it's more focusing on the persons, the individuals, and including them as much as possible in not only the actions, but the decisions, and feeling that they're part of the game, they have skin in the game. And that's what I felt also as a driving force when I took over the directorate of for Africa, the director of Africa position back last summer in 2020, when immediately the first reaction I had was to organize with my colleagues also a session on what it really means to be an inclusive leader, and to think again about different lessons in life and those additions that you want to add when you have, the advanced studies in a curriculum, and the interest, I think, in leadership and inclusive leadership is what really drives me. And that goes back to your initial comment in the intro about servant leadership. That's where, when I dug deeper in who I am and who I represent, I understood that being at the service of others was the main focus. It was my main focus, was my main interest, as if others were empowered in their job, that was my, my success. That was the peak of my success. And at the end of the day, I think this is what leadership is about, is driving from behind sometimes, or driving from front, and pulling or pushing, but keeping people at the center rather than at the periphery, and building your own success on behalf of others rather than with others. I know it's a lot of philosophy, but I have a lot of these examples in the field where you get inspired by a driver and by the big boss, and that's, it's the I don't have the word in English, but it's the oscillation entre between the there and here and there that brings indeed the added value, and I think the drive to become again as inclusive as possible, but also learn from your experiences.
Yeah, and I can tell you, I love what you shared. It's true in corporate world. It's true with institutions, public spaces. Many leaders we've been chatting and talking with through this podcast share the same thing. I always say people first, and I think genuine leaders like you, servant leadership, this is really what matters most. And you said it beautifully. It's not how much you deliver, but how you deliver and how you lead for the peoples that you have. One of the things we discussed a little bit prior, as you took Africa and the leadership for ICRC in Africa in really a crazy time with all the pandemic, a lot has been said around the COVID pandemic in Africa and how this is managed. And I know that last time we discussed, you're still worried about the health in Africa and the outbreak. Anything you can share with us from your perspective globally on this topic? And as many are from healthcare who will be listening to this podcast, any thought globally from your side on what's going there and how you're working every day to make sure that the population is safe?
So as you probably know, and we've discussed that, the ICRC, alongside the National Red Cross and Red Crescent organizations, works to alleviate the suffering of people, but also, and that was very clear when in Africa, when you work in Africa and you understand that we're mostly working in places that have different layers of fragility. One, because many of the contexts we work in are prone to protracted crises, to prolonged crises. Somalia, for example, I dare ask how many years we've been in war. Somalia, Sudan, South Sudan, DRC, the Central African Republic, Nigeria, Libya, and I can list even more contexts where there is a war, there is a level of violence, there are climate hazards, climate risks, like in Somalia or in the northern part of Ethiopia last year with the locust infestation. And then COVID comes on top, right? The pandemic is just one more deadly threat among many. So that's where the ICRC tried to work on adaptive capacity of people, try to reinforce the resilience of individuals and communities, serve as much as possible the communities affected to get better access to health services in places that are already challenged by lack of infrastructure, lack of development prospects. When you don't have a hospital, when you have a clinic that was shut off because of the war, when you have 700 medical personnel who left the north of Mozambique because of the war, then you have a huge problem, and COVID is not one of them. Our work has oscillated again between structure, infrastructure, support to local institutions, as well as supporting individuals. And we zoomed in, we focused on those who we call people off the grid, those who are anyway neglected, those internally displaced, the IDPs in displacement camps, refugees, for example, or those in places of detention, in prisons, where physical distancing is impossible. And these were indeed those were the priority categories for the ICRC. Why? We didn't neglect the rest, but we worked in complementarity to the World Health Organization, to Médecins Sans Frontières, to local organizations and ministries of health, because we thought that that was the logic behind using this as a positive momentum to try and change and help hospitals, medical centers, communities be ready for the next challenge. And we immediately thought that the pandemic is not something that will last only for 6 months or 1 year. We're certainly here up for a decade of having the same rhythm of new mutations and trying to adapt the vaccines to the new mutations and issues like that. So again, the vision is of a long haul, one, and second is one that pushes governments not to neglect normal immunizations against preventable diseases, particularly for populations in conflict settings. So in addition to COVID, which at times was just a mirage in many of the African countries, to be honest with you, in the beginning of the crisis, and that's what probably explains why we do have less statistics or less viable statistics in Africa, but also less victims of COVID-19 on the continent compared to other places like the US or Asia or even the Middle East. So that's in a nutshell where the ICRC has tried to put first its leadership role in preventing the spread of the disease with alongside national societies, Red Cross and Red Crescent volunteers, the millions of those that were deployed in the middle of the pandemic, at the front line of the pandemic, to spread information, because we thought also that spreading concretely valid information and not to fall into the misinformation, disinformation, and issues that can derail the harnessing or protecting people was really at the center of our attention. So we went in the streets with the communities to, again, spread preventive messages, COVID-19, wash your hands, and so on and so forth, as well as the support that I detailed in the beginning of my answer.
It's just so humbling hearing you. I don't know how to transition to the next session, but it's so humbling to hear all that you're doing in places that really needs most of the help, and it makes us realize again and again, in many different countries, how privileged we are for the healthcare we have. With this, Patrick, I'd love to jump into a section where I will be giving you one word, and I want you to say the top of mind idea that comes. So the first word is leadership.
Empathy. That's the word that comes to mind immediately. Is that what you want, right? The word.
Yes, empathy. It summarizes it beautifully. What about health?
Health. Right. Right. Like a human right.
Can you tell us more? Because I think you fight for this on a daily basis.
Yeah, well, it's true that some things that we take for a given in our communities have shown that the pandemic has kind of put us all at nudes with the assumption that everyone has access to healthcare. It showed that in the United States, like in France, like in Asia, like in China, like in Africa, that health was not a given to everyone, that it was, we needed to search for a better health. And it showed kind of our vulnerability. Communities that were quite well organized in France, in the United States, or in Switzerland, where I'm talking now, showed the limits of how much we can be ready and how much we can afford providing access to healthcare for everyone. When you go back to those countries affected by wars and violence, you realize how the basic right is not attained. We had, just to give you an example, in one of the countries, without naming them, the tragedy was that every time a kid got sick, they used to administer some Panadol or something else, and brought the mortality rates to very high levels. When we integrated an innovative way and some support into the structures of the health facilities where we operated, brought a small innovation into the mix, we lowered quite substantially the number of children dying because of bad diagnosis and by bad remedies. And that's very simple to say that, and I'm sure in most of the world with better access to technology, where mobile penetration or internet penetration is much higher than in Africa, although the data there shows impressive numbers. We can, do more to make this human right, this simple right, accessible to everyone. And again, COVID kind of put us all at flat with that notion that everyone, we are privileged, you are less privileged. Everyone has that need. And if anything, COVID should teach us how to leapfrog, how to go beyond the fragilities and make something concretely, change the reality for those millions of people who have to walk for miles and miles to get one Panadol. And this is not a mirage. These are the beneficiaries of the programs of many international organizations today in the field in Africa, where people still suffer to get that simple thing that is healthcare. That is not because there's no center, but it's a combination of elements and reasons why, unfortunately, this is still not a given in today's world.
What about 102 or 102?
102 is the school. That's the school that brought us up in a way. That's what I said earlier. It's the place where you can't impress anyone. You can only be humble and modest because you're surrounded by people who got the same experience from their predecessors and are only willing to give you that experience. And that, it's just a transmission of values and experiences that you probably get at home or from the Boy Scouts or from a club. But joining this impressive group of people, and that is our Red Cross Center in Lebanon, and helps you implement the values, put them in a framework and implement them, is something out of the ordinary. It's something that, something that brought me closer to the reality of, an 18-year-old guy who just came out of war, but also brought me to meet my wife, to, bring up a family, and simply because of Miotnen, of 102.
Yeah, such a school of life, as you said. The last word is spread love in organizations.
Wow, that's a discovery. I would say discovery. It's simply there will never be enough initiatives like the one that you've launched. Spreading love and spreading empathy, or spreading love can be misunderstood or badly understood. But what I understand from this is indeed to kind of retain or reignite that essence that we should all be in the empathy business and the love business, and how much we should be measured at how much impact and love and empathy we managed to bring into the world. How much did we amplify our EQ rather than our IQ in our organizations? How can we bring those suffering that probably will never come forward, but how to detect them and how to bring the employees' experience to the optimal level is probably what makes us better leaders than only the managers that we know how to be, and simply what we learn from school and university. But we're never taught how to be leaders. Leaders are brought up naturally, I think, and that's probably what we can keep as a legacy once we leave our organizations.
Any final word of wisdom for the leaders in healthcare around the world, whether in private sector, public, or in NGOs and humanitarian?
Well, I'm afraid that if I attempt any wisdom, it will fall down and break into 1,000 pieces. But I think the question of impact, and so looking beyond one's own expertise, is something that we kind of undervalue, underestimate, as if we were all brought up as experts in our fields of work. We kind of neglect the rest. And again, you are in a field of work and you're talking about how to spread love in organizations. And I think my message of, if I may, the message that you're asking me to spread today is one about collaboration and about, working across sectors, getting people together around a value or around an outcome-based approach, rather than simply looking at a problem and trying to bring a solution. We've seen how the pandemic has, again, weakened us all in our physical, mental, psychological, but also our own assets are fragilized because of the pandemic, of something that we thought would be, a simple passage through our lives, when this will now define us, who we are and how we get out of this crisis in a better shape, hopefully. So, voila, that's what I can say.
Yeah, what a message! A strong message of hope and real co-work across the different stakeholders in healthcare. Thank you so much, Patrick, again for being with me today, and for all that you do and that your team do. All the teams that you have do every single day to make the world a better place. It's so humbling to hear you, and we can just be inspired by your energy, your passion, as you defined it, your work to improve health and beyond health in the places that need it most.
Thank you, Naji. Thank you. And you said it right. It's all about them. It's about the workers on the ground. It's about those who are, putting themselves at the front line every day. And if we manage from our own positions to influence, to help, and to maximize impact, then, as you are doing right now, providing that inspiration, then I think we are on the right track. So thanks again, really, for the opportunity.
Thank you all for listening today. Let's stay connected on SpreadLoveIO.com, Apple, Google, or Spotify to hear more from great leaders in healthcare. And most importantly, spread love in your organizations and spread the word around you to inspire others and amplify this movement our world so desperately needs.